Hello folks, we're going to talk about coronavirus today, so stay tuned. A newly identified respiratory virus causes pneumonia was recently discovered in China and soon spread throughout the country. It has also been recorded in so many countries, including Iran. The World Health Organization declared a global health emergency over this new virus that has killed thousands of people following the outbreak in the city of Wuhan.
But what is coronavirus anyway? According to the WHO, coronaviruses are a family of viruses that cause illnesses ranging from the common cold to more severe diseases like severe acute respiratory syndrome, also known as SARS. You must also know that coronaviruses are zoonotic. However, several known coronaviruses are circulating in animals that have not yet infected humans.
So what are the symptoms? Actually, the viruses can make people sick, usually with a mild to moderate upper respiratory tract illness, similar to a common cold. Coronavirus symptoms include a runny nose, cough, sore throat, possibly a headache, shortness of breath, breathing difficulties, and fever, which can last for a couple of days.
For those with a weakened immune system, such as elder or very young, there is a chance that virus could cause a lower or much more serious respiratory tract illness, like pneumonia or bronchitis. In more severe cases, it can lead to multiple organ failure and even death. Current estimate of the incubation period ranges from 1 to 14 days. Most infected people show symptoms within 5 to 6 days. However, infected patients can also be asymptomatic, meaning they do not display any symptom despite having the virus in their system.
How does it spread? Viruses can spread from human in contact with animals. Scientists think SARS started in civet cats and then transferred to humans. Officials do not yet know what animal may have caused the current outbreak in Wuhan. When it comes to human transmission of the viruses, often it happens when someone comes into contact with an infected person's secretions, such as droplets in a cough. Depending on how virulent the virus is, a cough, sneeze, or handshake could cause exposure. The virus can also be transmitted by touching something an infected person has touched and then touching your mouth, nose, or eyes.
Is there any treatment? There is no specific treatment, but research is underway. Most of the time, symptoms will go away on their own, and experts advise seeking care early. Doctors can relieve symptoms by prescribing a pain or fever medication. The Center of Disease Control and Prevention of the United States, CDC, says a room humidifier or a hot shower can help with a sore throat or cough, as well as drinking plenty of fluids, getting rest, and sleeping as much as possible.
Some might ask, if there's no treatment, how can we fight back? Well, in this case, you should know that you may be able to reduce your risk of infection by avoiding people who are sick. Try to avoid touching your eyes, nose, and mouth. Wash your hands more often with soap and water for at least 20 seconds each time. Cover your mouth and nose when you cough or sneeze, and disinfect the objects and surfaces you touch. Believe it or not, awareness is the key.
I remember that time we were sipping on wine. I could see it in your eyes, you were feeling alive. But I tell you I was